Today, I would like to shine light on one of the most pressing issues millions of women around the world face: the effects of war on women's reproductive health and well being. First, I'd like to share a little bit about myself. My name is Priyanka, and I'm a rising sophomore at University High School in Irvine, California. I am especially passionate about cell biology and public health, specifically women's health and improving access to care in underserved communities. At school, I'm involved with HOSA, the Health Occupation Students of America, as well as the South Asian Student Association. Outside of school, I spend much of my free time volunteering with CHOC, the Children's Hospital of Orange County, and also through giving back projects such as community service projects and fundraising initiatives with Girl Scouts of Orange County. I also enjoy graphic design and photography. Before proceeding, I would like to give a content warning. Please note that this presentation does contain references of sexual violence, gender-based violence, and traumatic experiences in conflict zones. Viewer discretion is advised. When war breaks out, we think of borders, bombings, and political power shifts. But not enough people think about what happens to women's health. Conflict zones lead to collapsing health systems. Hospitals are destroyed, supply chains break, and basic services vanish. For women, this means losing access to safe childbirth, contraception, as well as menstrual care. This presentation focuses on that overlooked reality, not as a political stance, but as a public health emergency. The global numbers are staggering. The UN reports that 60% of preventable maternal deaths happen in crisis zones. Women face extreme challenges accessing basic care, and gender-based violence becomes a widespread weapon of war. These are public health failures that can no longer be ignored. In Afghanistan, the Taliban's return to power in 2021 has devastated healthcare access for women. The UNFPA estimated that 4.5 million Afghan women were in need of reproductive health services in just 2022. Yet, women are banned from traveling without a male guardian, and thousands of female healthcare workers have been dismissed. Skilled birth attendants are no longer available in countless regions. According to Save the Children, 80% of births in rural areas now occur without any medical supervision. Sexual violence is another rising crisis. Under the Taliban rule, there has been a dramatic increase in early and forced marriages, some of the girls as young as just 10 years old. With no legal recourse, these child brides are subject to lifelong abuse and forced pregnancies. Survivors of violence cannot safely report crimes or even receive proper medical attention. A midwife interviewed by the BBC described hiding pregnant women in private homes to avoid Taliban patrols. One clinic reported patients arriving after walking for 12 hours because they feared male checkpoints. Maternal mortality is now among the highest in the world, with one woman dying every 2 hours from preventable causes. In Gaza, women's reproductive health is under siege. The Israeli blockade, compounded by repeated airstrikes, has devastated medical infrastructure. According to the UNOCHA, over 50% of primary care clinics in Gaza were destroyed or rendered non-functional in 2023 alone. Pregnant women are turned away from overcrowded hospitals or forced to give birth in shelters. Doctors Without Borders reported that many deliveries now happen without anesthesia or trained staff. In one documented case, a woman gave birth in a stairwell during an airstrike. Midwives report lacking basic tools like gloves and clean water. The period poverty is also severe. Due to import restrictions and collapsed supply chains, menstrual products are scarce. Many women use old rags or cardboard, increasing the risk of infection. A UNFPA report found that 65% of displaced girls in Gaza do not have access to sanitary pads or any menstrual hygiene products. Sexual exploitation is another growing concern. In crowded shelters, some women have reported being coerced into sexual acts in exchange for basic needs like food or diapers. These cases often go unreported due to societal taboos, fear of shame, or retaliation. There are virtually no legal or medical protection for these survivors. Kashmir has been in a state of prolonged conflict for decades. Movement restrictions increased, affecting the access to healthcare. During COVID lockdowns, this was even more extreme. Pregnant women reported walking miles due to blocked roads and a lack of transport. A 2021 study from the International Journal of Health Services found that nearly 60% of Kashmiri women in remote villages gave birth at home without any medical support at all. Hospitals were either too far or blocked by armed checkpoints. Neonatal deaths are significantly higher in border districts. Mental health is also deeply affected. A MSF report revealed that 45% of Kashmiri women surveyed suffered from depression and 22% showed symptoms of PTSD. Yet, few clinics offer psychiatric care, especially for women. So, why don't we hear more about these women? Because war coverage focuses on politics and power, not people in pain. Reproductive health is often labeled non-essential, even though childbirth, menstruation, and recovery do not stop during war. Period stigma and cultural taboos around rape silences survivors. And most humanitarian aid systems are designed for the average adult, not for someone in labor or dealing with trauma from sexual violence. There are solutions, however, if we are willing to center women in crisis planning. Humanitarian responses must include maternal services, menstrual hygiene kits, and trauma care. Female doctors, nurses, and midwives must be protected, not dismissed. And lastly, we must push for accountability, not just from governments, but also international aid organizations, to ensure that no woman is left behind in a war zone. Before I wrap up, I'd like to take a moment to express my gratitude. Thank you so much to the Johns Hopkins Student Speaker Series team for giving me the opportunity to share this project. I am also especially grateful to the mentors who have guided me in finding ways to truly help these women in crisis zones. And most importantly, I would like to honor and thank the women whose stories make this presentation possible. Your strength and resilience continues to inspire me every day. And last, but certainly not the least, I would like to thank you, the listener, for listening. Should you have any questions, feel free to reach out to me via email, and I would be more than happy to address them. Thank you.